Good day, Karolina. It's great to have you on today, and we would love to hear about you and what you do within the Southern Trust.
Hi, Gemma. Thank you. Lovely to see you as well. So, as you already said, I'm Karolina. I'm one of the midwives of the Southern Trust. I've been part of the trust since October 2016, and currently I'm working as part of one of my roles as a midwife in the Stop Smoking team. I have been part of this team for coming up to almost a year now. We started in April of 2023. During my time in the Southern Trust, I also work in a couple of other roles. So, I've big passion and really love health promotion. And one of my other roles is within the infant feeding team. And I also provide antenatal education classes in the evening. So sort of all coming together under the health promotion umbrella, I suppose, you could say. And it's something I feel really passionate about and really love sharing knowledge and information with our women that come through the service.
Thank you, Carolina. So, you've come on today on this Stop Smoking Month of March. So, I'm going to ask you for the audience, what does your job within the Stop Smoking service mean to you and what does it entail?
So yes, March is our Stop Smoking Month, and it's a really fantastic time to promote the service. And within our trust, we're very lucky to have actually a fantastic team of 4 midwives that provide and support our women with the Stop Smoking service. We also actually work alongside of a wider Stop Smoking team. So we have specialists in the likes of community areas, in the mental health services, and within the hospital. So as a wider team, we provide the service throughout the trust. So in terms of my role and what it entails, obviously working as a midwife, I support women during pregnancy. And we can also support their partners as well. So if maybe the mum herself doesn't smoke, but her partner does, we obviously know then secondhand smoking can affect mum's health and health of developing baby. Thinking also for postnatal period at home, we want to provide support to the whole family circle. So it could be mum's partner or another family member who lives with mum that we can offer support to alongside. Sometimes we do 2 people at the same time, so it could be couples as well. But my role specifically really revolves around supporting women with quitting in pregnancy. We know that a lot of people do reduce smoking, but actual benefits are seen quite significantly higher whenever women stop altogether. So this is where our role comes in, where we can offer support and help women understand what their smoking habits are like, help them maybe map out areas for potential difficulties when it comes to quitting, give them an idea of, what is the benefits, how it benefits their health, health of their baby, potentially even other benefits like we're thinking about lifestyle changes, changes to their even family circumstances, like financially. We know there's so much going on in the background of smoking. We know it's much more complex than just the cigarette itself. We know that addictions are quite challenging, and our role really is there to support women every step of the way. Sometimes it's early on in relation to just preparing and mentally getting into the right headspace for quitting, and then guiding them through their quit journey. Some women will quit just with support. Other women maybe find it a little bit harder and then decide to go down the route of nicotine replacement therapy, which is medication that we can organise alongside the women's GP to help then those mums to quit. We know that NRT is safe in pregnancy, and it does benefit to try it out if maybe the mum struggles to quit just on her own. So that would be, I suppose, another part of my role, just liaising with the GPs and working alongside of them to arrange the medication according to what the mummy's needs are.
Brilliant. Thank you so much. And what would you say would be the most rewarding part of your job?
Well, obviously, as you'd appreciate, the most rewarding is if we get somebody to their quit and to help them maintain their quit. And that's the best part of my job, is being able to help people with that. It is a challenging process, and I have to say, it really has opened my eyes being in this role, how just difficult it is. I always knew and understood addictions quite well, but really just seeing what it looks like day to day, and I suppose to make it a little bit easier, for everybody. I often say, that smoking is a complex process, and it definitely isn't something that everybody can do as well as other people. So we often would say to women, don't compare yourself to other people. It is so important to think of it as your own attempt, and it doesn't matter that maybe you've tried in the past and it didn't work. Pregnancy is a very different time. Sometimes our motivation levels are very different, and you are maybe more likely to quit actually while you're pregnant. So, it's I suppose there's a lot of different aspects to my role, not just what we've talked about already. There's a lot more sort of support that we can extend, for the duration of the pregnancy journey, not just maybe for the 12-week of the program that women will go through as part of the Stop Smoking service, but actually beyond that as well. So I suppose I love all aspects of that. And it's definitely a very rewarding job. And I just love seeing women come through the process and actually come out at the end of it and they're quit and just feel really good physically and mentally, and they know they're doing the best they can for their baby. Because when you quit in pregnancy, you're benefit both for yourself and your baby. So you're quitting for two, which is really, really fantastic.
Brilliant. Thank you so much, Karolina. So you talked about nicotine replacement therapy. So what does that look like for a pregnant woman who's looking to quit?
So I'm not sure if those who are listening are familiar with nicotine replacement, but I'm supposed to explain it in a little bit more detail. Very often it's referred to as NRT, so just to know that that's one and the same thing. But it's basically licensed medication that we know is a safe alternative to smoking. We know that in pregnancy, a lot of women do still go through the cravings the same as outside of pregnancy, and nicotine replacement can really help with those cravings and managing those. It is a licensed product, meaning that it has been trialed accordingly, and there's certain ones that are recommended for pregnancy, maybe ones that we don't use in pregnancy. So maybe other times in your life you can, but in pregnancy we would avoid. So for example, a good example of this would be nicotine patches. So we use the shorter release patch. So we use a 16-hour patch versus a 24-hour patch then in pregnancy, because we know that although it is safe, we don't want the persistently high dose of nicotine to be given to mum throughout all the 24-hour period. So we would use just a variant of that product, and then there's other products alongside that we can use as well. For a lot of people, they maybe need something that doesn't have as high a strength as a patch, so they will use products that are called intermittent products. So things like gum, different types of lozenges, or micro tablets that can dissolve very quickly on your tongue and give you a really good boost of nicotine for those really sharp and sort of sudden cravings. And then you can also use products. Some people will maybe use the likes of an inhalator that they like, for the simple fact that it gives you, I suppose, a replication of the hand-to-mouth action. And a lot of people do find that that's something that they maybe miss and crave, and it could be maybe a trigger for them towards relapse, and that can really help with that. So nicotine replacement really works alongside of replacing the nicotine that our body craves, which is the addictive part of your cigarette, but it takes out all the other problematic ingredients. We know that a cigarette contains over 4,000 chemicals, and they can obviously have a really significant impact on both mum's health and the developing baby. So by taking nicotine replacement, you are removing the negative chemicals. So you're keeping the nicotine to help our bodies cope with the quitting attempt, to help you work through the nicotine withdrawal. And with the program that we provide, we work with mummy over a length of time to then reduce the nicotine. So the idea is by the time she finishes the program with us, she is actually neither smoking nor using nicotine replacement therapy, because we want you to be able to quit altogether. And the program is tailored to your needs. Yes, we talk about a 12-week program, and in general it is 12 weeks that most people will use nicotine replacement therapy for, but sometimes we support women beyond that. Often we maybe take a few weeks beforehand to prepare and get ready for a quit attempt, and then start the nicotine replacement, work through the 12-week program, and then following that we'll also keep our women on for support afterwards as well. Sometimes we'll then maybe make contact with women later down the line if they're maybe worried about relapse postnatally, which some people can really be quite anxious of, because they maybe feel great level of motivation while they're pregnant because baby's on board, and they really feel that yes, this is actually much easier to be quit right now, but maybe past pregnancy, following birth of baby, they maybe do find cravings are coming back up, and that's when we'll maybe pick up a little bit more intense support then at that stage as well, to help them and maintain their quit, maybe sometimes even go back to nicotine replacement if we're really having a hard time for maybe a short period of time as well. So nicotine replacement does have a really fantastic place within this role, and I do find a lot of people like it. And it is sometimes trial and error until we find the right product that suits a mum, but we do have quite a few to choose from, which is really good. And vast majority of them, thankfully, are safe in pregnancy as well.
Brilliant, thank you. And what advice, Karolina, would you give to somebody who's maybe watching this right now and are struggling? They're pregnant, they're feeling nauseated, and they're just feeling very vulnerable and they're not sure whether they can do this or not.
Yeah, I think the most important thing to say is that you can do it. I think a lot of it comes down to our lack of belief in ourselves when it comes to quitting. And once we've chatted through a lot of things with most mums, I find actually that they feel that they're in a better headspace after a conversation. So just talking to somebody, knowing that midwives are there for support first and foremost. So we want to have that conversation, be open, be honest with us, let us know what's happening. I very often will say to the women on my caseload, remember that I'm here to talk to as much as everything else and all the paperwork and the NRT, all of that. Yes, we'll figure all of that out, but the bottom line is to talk and help you prepare and reassuring yourself there's lots of different strategies that we can adapt. I very often would say about the fact that statistics speak for themselves, that when you engage in stop smoking service, when you avail of nicotine replacement therapy, you're 4 times more likely to quit. And I think that's really powerful. You need to remember that you can do it. And it may not happen the first time you do it. It may take a few attempts. And statistically speaking, they would say sometimes for an adult in their lifetime of quitting, it can be 6 times before they're actually successful. So don't be put off by the fact that maybe you've tried it for a couple of days and it didn't work and you feel, oh, no, I don't want to do it again. I would often say, start fresh. Often we need to take it one day at a time, sometimes even one cigarette at a time, and trying to get through that early morning, maybe that late afternoon, whatever time that is a tough time for you. Getting through that even one day at a time is so important. And knowing that that support is there, you can lift the phone, you can talk to us, you can text us. There's so many other resources out there too. I often encourage women to download even the likes of the NHS Quit Smoking app, which can be a fantastic thing just to have in your pocket, that if you're struggling during a break, you can take out and have a look and you set your goals. It often motivates you with the fact that it tells you, maybe like how many days of a streak you have that you've quit. What does that look like to you in terms of what it means to you? You could be thinking, maybe my motivation is pregnancy. So maybe reading over all those benefits that you give your baby by quitting will just give you that wee bit of a boost. And you might think, right, okay, yes, I know what I'm doing this. Or maybe doing things like looking at finances. For a lot of people, the cost of smoking is a massive motivating factor, whether you're pregnant or not. So even seeing something like the app provides you with a little countdown of how much you've saved, that could be a really motivating thing. I often say distraction techniques can really be so good for us, and we can often adapt actually really positive changes to our lifestyle while we're trying to quit. So getting out for a walk, being a little bit more physically active, we can really help our bodies through it. So definitely, you can do it. No matter your circumstances, no matter how early or how late you are in your pregnancy, at any stage, quitting is really so beneficial, and we would love to support you with it. So myself, I work in Craigavon and across Armagh. I have colleagues who work in other clinical areas. So I have a colleague called Eve who works alongside of me in Craigavon, but also covers the likes of Brownlow community area and Banbridge. I have a colleague Adele who covers the Newry and Mourne area, and I have a colleague Margaret who covers South Tyrone. So we are there where there's always somebody actually every day of the week that's on duty. I work a couple of days a week in this role and then other roles throughout the week, but I very often would maybe text my mummies back if I get a chance. It could be coming the end of my working day. I'll be double checking on my work phone and sending a text. So I know my colleagues are really tuned into that as well. And we support, throughout the week as much as we can. So reach out if you're having a hard time. You're maybe part of our caseload. I often say to mums, don't be afraid to tell your midwife what's really happening, because we're there to help you, and we want to know how to best guide you in this process. So hopefully that gives everybody a little bit of maybe reassurance as well. You know, we're not there to make you feel bad or make you feel guilty or anything like that. Our role is there to support. We know it's tough. Smoking is a serious addiction and it does take a lot of effort, but you can do it. And we're here every step of the way. And as I've already mentioned, you're 4 times more likely to quit if you quit with us. So we definitely want to hear from you. If you haven't thought about it before, and this is maybe first time you're hearing of this service, do know that you can refer to it anytime. Speak with your midwife. They can drop us a quick referral through our medical system within the hospital here, and it'll be a matter of time before you're getting a call from us. So do reach out for sure.
Karolina, that was so insightful. Thank you so much for your time today. And thank you for listening.
Thank you.